Legal and ethical issues. Ethics and laws guide behavior. Ethics are the knowledge of right and wrong. An ethical person has a sense of duty and responsibility toward others and always tries to do what is right. If ethics tell people what they should do, laws tell them what they must do. Laws are usually based on ethics. Laws are established to help all people live peacefully together and to ensure order and safety. Ethics and laws are extremely important in healthcare. They protect people receiving care and guide people providing care. Home health aides and other healthcare professionals should be guided by a code of ethics. They must know the laws that apply to their jobs. Examples of home health aide behaviors that are both legal and ethical. Being honest. Protecting patients' privacy. Reporting abuse or suspected abuse of a patient. Following the care plan in your assignments. Not performing tasks outside the scope of practice. No. Legal and ethical behaviors of home health aides. Continued. Reporting all patient observations and incidents to the agency's personnel. Documenting accurately and on time. Following rules about safety and infection prevention. Not accepting gifts or tips. Not becoming personally or sexually involved with patients or their family members. Define the following terms. Neglect. Harming a person physically, mentally or emotionally by failing to provide needed care. Active neglect. Purposely harming a person by failing to provide needed care. Passive neglect. Unintentionally harming a person physically, mentally or emotionally by failing to provide needed care. Negligence. Actions, or the failure to act or provide the proper care for a patient, resulting in unintended injury. Define the following terms. Malpractice. Professional misconduct that results in injury to a person through negligence, carelessness or lack of skill. Abuse. Purposefully mistreating and causing physical, mental or emotional pain or injury to someone. Physical abuse. Intentional or unintentional treatment that causes harm to a person's body. Psychological abuse. Emotional harm caused by threatening, scaring, humiliating, intimidating, isolating or insulting a person, or treating him or her as a child. Define the following terms. Verbal abuse. The use of spoken or written words, pictures or gestures that threaten, embarrass or insult a person. Assault. A threat to harm a person, resulting in the person feeling fearful that he or she will be harmed. Battery. The intentional touching of a person without his or her consent. Sexual abuse. The forcing of a person to perform or participate in sexual acts against his or her will. This includes unwanted touching, exposing oneself to a person, or sharing pornographic material. Remember, home health aides must never abuse patients in any way. They must also try to protect their patients from others who abuse them. If you ever see or suspect that another caregiver or a family member is abusing a patient, you must report this immediately to your supervisor and the agency. Reporting abuse or suspected abuse is not an option, it is the law. No. As a home health aide, you are in an excellent position to observe and report abuse or neglect. Home health aides have an ethical and legal responsibility to observe for signs of abuse and report suspected cases to the supervisor and the agency. Home health aides are considered mandated reporters. Mandated reporters are people who are required to report suspected or observed abuse or neglect, because they have regular contact with vulnerable populations, such as the elderly. If abuse is suspected or observed, the home health aide must report to the supervisor immediately. Giving as much information as possible is important. This is a serious responsibility, and home health aides can help end this disturbing trend. Remember, Who is vulnerable to abuse or neglect? Who is vulnerable to abuse or neglect? Some people are more vulnerable to adult abuse or neglect than others. They include the following: the elderly, the physically ill or disabled, the developmentally disabled, the mentally ill or disabled, people with communication problems, such as hearing, speech and vision impairments. All these people have a few things in common that make them so vulnerable. They are often unable to stand up for themselves and to report abuse or neglect to others. They may not even understand that they have rights to do so. Often these people can be much more demanding to care for, which increases their caregivers' stress. Their caregivers may not have been properly trained to care for these particular people, and they may not understand why these people behave the way they do. Caregivers may also be overworked, tired, stressed and unappreciated, on top of caring for someone who requires so much time and energy. These are the people who most need your help and protection from harm. They may not be able to speak for themselves, but the signs of abuse or neglect may speak for them, if you just know how to recognize these signs. Suspicious injuries. The following are considered suspicious injuries and must be reported: poisoning or traumatic injury, teeth marks, belt buckle or strap marks, bruises, contusions or welts, scars, fractures, dislocation, burns of unusual shape and or in unusual locations, Chigarita burns, scalding burns, scratches and puncture wounds, scalp tenderness and patches of missing hair, swelling in the face, broken teeth, nasal discharge, bruises, bleeding or discharge from the vaginal area. Signs of abuse. Signs that could indicate abuse include as follows: yelling obscenities, fear, apprehension, fear of being alone, poor self-control, constant pain, threatening to hurt others, withdrawal or apathy, alcohol or drug abuse, agitation or anxiety, signs of stress, low self-esteem, mood changes, confusion, disorientation. Private conversations are not allowed, or the family member caregiver is present during all conversations. Reports of questionable care by the patient and his or her family. Signs of neglect. Signs that could indicate neglect include as follows: pressure injuries, bed sores, unclean body, body lice, soiled bedding or incontinence briefs not being changed, poorly fitting clothing, unmet needs relating to hearing aids, eyeglasses, etc., weight loss, poor appetite, uneaten food, dehydration, living conditions that are unsafe, unclean, infested or inadequate. The following behaviors support patients' rights. Never abuse a patient physically, verbally, psychologically or sexually. Observe and report. Watch for and report any signs of abuse or neglect to supervisor. Call the patient by the name he or she prefers. Involve patients in planning and making their own choices and preferences about care. Explain procedures to the patient before performing them. Behaviors that support patients' rights continued. Respect a patient's refusal of care and report to supervisor immediately. Tell supervisor if a patient has questions, concerns or complaints about care. Be truthful when documenting care. Do not talk or gossip about patients. Keep patient information confidential. Knock and ask for permission before entering a patient's room. Behaviors that support patients' rights, continued. Do not open a patient's mail or look through his or her belongings. Do not accept gifts or money from patients. Report any questionable financial practices to supervisor. Respect patient's property and handle personal possessions gently and carefully. Report observations regarding a patient's condition or care. Anxiety and depression. Mental health is important to physical health. Reducing stress can help prevent some physical illnesses. It can help people cope if illness or disability occurs. Mental health can help protect and improve physical health. The reverse is also true. Physical illness or disability can cause or worsen mental illness. The stress these conditions create takes a toll on mental health. Different types of mental illness will affect how well patients communicate. Home health aides should treat each patient as an individual. They should tailor their approach to the situation. Do not talk to adults as if they were children. Use simple, clear statements in a normal tone of voice. Be sure that what you say and how you say it show respect or concern. Sit or stand at a normal distance from the patient. Be aware of your body language. Be honest and direct, as you would with any patient. Avoid arguments. Maintain eye contact and listen carefully. Anxiety and depression. There are many degrees of mental illness, from mild to severe. The person with severe mental illness may lose touch with reality and become unable to communicate or make decisions. Some people with mild mental illness, however, seem to function normally. They may sometimes become overwhelmed by stress or overly emotional. Many signs of mental illness are simply extreme behaviors most people occasionally experience. Being able to recognize such behavior can make it easier to understand patients who are mentally ill. Anxiety is uneasiness, worry or fear, often about a situation or condition. When a person who is mentally healthy feels anxiety, he or she can usually identify the cause. The anxiety fades once the cause is removed. A person who is mentally ill may feel anxiety all the time. He or she may not know the reason for feeling anxious. Anxiety causes physical symptoms, such as shaking, muscle aches, sweating, cold and clammy hands, dizziness, chest pain, rapid heartbeat, cold or hot flashes, a choking or smothering sensation and/or a dry mouth. Anxiety and depression. Depression is a type of mood disorder. Depression is characterized by a loss of interest in everything a person once cared about, and may interfere with the person's ability to work, sleep and eat. It may cause intense mental, emotional and physical pain and disability. Depression also makes other illnesses worse. If left untreated in older adults, it may result in suicide. Depression is not a normal reaction to stress. Sadness is only one sign of this illness. Not all the people who have depression complain of sadness or appear sad. Other common symptoms of depression include pain, headaches, abdominal pain and other body aches, low energy, fatigue, apathy, lack of interest in activities, irritability, anxiety. Anxiety and depression. Other common symptoms of depression include continued loss of appetite or overeating, problems with sexual functioning and desire, sleeplessness, difficulty sleeping or excessive sleeping, lack of attention to basic personal care tasks, bathing, changing clothes, etc. Intense feelings of despair, guilt, difficulty concentrating, withdrawal and isolation, repeated thoughts of suicide and death. Depression is very common in the elderly population. It can occur in conjunction with other illnesses, such as cancer, AIDS, Alzheimer's disease, diabetes or heart attack. It can happen after the death of a loved one. Depression is an illness and must be treated as such. People who suffer from depression need compassion and support. Home health aides must know the symptoms, so they can recognize the beginning or worsening of depression. Any suicide threat should be taken seriously and reported immediately to supervisor and the agency. It should not be dismissed as an attempt to get attention. No. Anxiety and depression. Everyone gets irritable or sad from time to time, but if it becomes a long-term condition or becomes severe, in this case the person may become clinically depressed. Home health aides should carefully observe their patients. Home health aides should not draw conclusions about the cause of the behavior. Home health aides must only report facts, including what they saw or heard, how long the behavior lasted, how frequently it occurred. What can be done? Listen to what patients say. Accept them as they are without judgments. Give them time to get their thoughts together and tell you what they're thinking or feeling. Encourage daily exercise and pleasant social activities. Make sure that the patient takes medications in the correct way and on time. Encourage balanced and nutritious diet. Pay attention if you suspect that the patient is thinking about suicide. Ask if he or she is. Do not be afraid that you will be giving them ideas. If they tell you they are having these thoughts, you must report to your supervising scheduling coordinator immediately. Substance abuse. Substance abuse is the repeated use of legal or illegal substances in a way that is harmful to oneself or others. Many types of substances are abused, including alcohol, tobacco, legal and illegal drugs, etc. Over-the-counter medications, including diet aids and decongestants, can be addictive and harmful. Even household substances, such as paint or glue, are abused, causing injury and death. The harm caused by substance abuse may come in many forms: damage to the abuser's health, legal problems, damage to the abuser's relationships with family. Chemical dependency is more severe and may involve needing greater amounts of the drug and having symptoms even when not using it. In this situation, chemical dependency is a disease. It affects a person physically, mentally and emotionally. It is treatable, but frequently requires diagnosis and care by specialists. A home health aide may be in a position to observe the signs of substance abuse in patients or their family members. The home health aide must report these signs to the coordinator in the agency. Observations can be made without accusing anyone of abuse. The home health aide should simply report what he or she sees, not what he or she thinks the cause may be. Substance abuse. Home health aides must observe and report the following: changes in physical appearance, red eyes, dilated pupils, weight loss, changes in personality, moodiness, strange behavior, disruption of routines, lying, irritability, smell of alcohol, cigarettes or other substances on breath or on clothing, diminished sense of smell, unexplained changes in vital signs, loss of appetite, inability to function normally, need for money, or money missing from the home, confusion, forgetfulness, blackouts or memory loss, alcohol or cigarettes missing from the home, frequent accidents, problems with family,